following portion of the Arizona Daily Mix is sponsored by Aging and Awesome.
There are some big changes coming to Medicare in 2025, and it's not that far away. Our guest, insurance expert Kai Sisson, wants to make sure that you have all the facts. Welcome to the show.
Thank you, Teresa. Glad to be back.
Big changes coming.
The Inflation Reduction Act, ever heard of it?
Yes.
It was passed in 2022. All the politicians like to brag about it on TV. Massive changes to prescription drug coverage, particularly with Medicare beneficiaries. So when you walk into the pharmacy come January 1, expect changes. Those changes are actually good. These are good changes, and I'll get to the bad changes.
Okay, we'll
next.
start with the good.
Yeah. The good change is that there's a $2,000 out-of-pocket maximum for your prescription drug costs. In the state of Arizona, only 2.75% of you watching that are on Medicare will see a net savings. Those 2.75% spend more than $2,000 currently. 2025, they'll be capped, so that's great news for them. It's getting rid of the donut hole. Right now, Medicare seniors have initial donut hole catastrophic coverage. They're getting rid of that middle where they used to be cheap drugs all the way until like June, July, August, and then they spike,
yep.
And then they go back down towards the end of the year. So they're getting rid of that. You can now even have your plan bill you for your prescription medications to even out the payments each month. So they're making it much more, affordable for seniors that have expensive medications. And number two, ability to pay for them, not at the pharmacy, but over time to pay them off throughout the calendar year. So those are the biggest changes, the good changes. The downside is for Part D. Yeah. If you have a Part D standalone plan, you're likely to see an increase in premiums. If you have a Medicare Advantage plan, possibly some premiums, but more so they are going to be pulling back on the benefits that people have been enjoying for 2 decades. Things like transportation, food cards, dental, vision, hearing, all of those benefits are on the table. Certain plans had fancy benefits like golf shoes. Oh, go buy a pair of golf shoes and we'll pay you back.
Get your exercise.
Exactly.
This is for your wellness.
Yes, so some of those had those supplement kind of somewhat frivolous just in terms of your health care are really going to be eliminated for the most part.
So goodbye golf shoes.
Yeah.
But for some people, like for example, my dad, his urologist that he really loves is far away, and if I can't take him, he'll take an Uber. That could cost $18, $25, $30 on a fixed income. That makes a difference.
Absolutely.
in his week.
Yes, and so now we need to talk about, will your plan cover transportation in 2025? Because all those benefits are on the table because of the Inflation Reduction Act.
Is there anything else that people should know before January 1st?
It's the enrollment periods right now. It goes through December 7th. So you're allowed to evaluate, see if you're on an Advantage plan, to start January 1. You got to do it before December 7th. But if a lot of people don't know this, if you're on an Advantage plan in the first quarter of the year, you also can reevaluate for the first 3 months to switch for the rest of 2025. So yes, get it done now before December 7th, but rest assured, if you wake up on January 1 and you're like, wait, my drugs are more, my transportation's gone, my dental's down, and you need to reevaluate. No golf shoes. You can also do it in the first quarter of the year.
That is so good to know. Yes. Kai, thank you so much. So this is something you really should take care of now. There is a little wiggle room, as Kai mentioned, but it's probably worth your while to write down the number and the information that you see right now on your screen in case you need Kai's help later. There's also information on our website at cw7az.com. Thank you again so much.
The preceding portion of the Arizona Daily Mix was sponsored by Aging and Awesome.